Ladies and gentlemen, as participants, chairman, and the committee of the 8th UNPAD Nursing Conference. On this occasion, I will present a research that our team has been working on regarding professional nurse role modeling during the COVID-19 pandemic. So this is a mixed method study. Allow me to introduce our researcher team. That is Dr. Nigusti Ayu Eka, me myself, Christie Lidya, and Peggy Sarah. And the three of us are lecturers at Universitas Pelita Harapan in Lipo, Karawaci. So the table of content that we will discuss here summarize the introduction, method, results, discussion and conclusion, and also references. The reason why we conducted this study begins with the idea from several studies previously. And also as we see in our daily picture in nursing education, that nurse educators can basically impart knowledge, abilities, and attitudes through role modeling, particularly regarding professional nurse conduct. As Jayasuriya stated that role modeling refers to the admiration of an individual's observed behavior or attitude and the subsequent adoption of that attitude. The implication in academic and clinical practice is role models as professional nurses are described as teaching by example and modeling their students' learning. Then this idea was continued by Baldwin as he claimed that as a role model, a nurse educator could contribute to students' self-discovery, self-motivation, and self-confidence, as well as their appreciation of high-quality care and professional growth. So we think that this is important to shape students' professionalism through role modeling during academic and professional learning, especially when there are many adjustments and restrictions due to COVID-19 outbreak. Nursing learning methods that ideally require a lot of interaction with face-to-face meetings then should be modified into online or hybrid learning. That this can potentially cause differences in learning rhythms, communication patterns, motivation, and students' perception regarding role modeling. The study was conducted in a mixed method design with sequential explanatory approach. The study was located at one private faculty of nursing in Indonesia, begins in March to July 2022. The study involved 120 students in quantitative stage and 10 students participated in qualitative study that all of them were undergoing the professional stage that time and was practicing during COVID-19 outbreak. Data in quantitative stage obtained through role model questionnaire developed by our team on previous study. In qualitative stage, we use a semi-structured interviews using the guidelines that was adapted from the reflective paper of teachers' experiences as role model. So this reflective paper was generated in study done by Mohabadi et al. In 2021. Data collection in the qualitative stage involved 10 purposive selected participants representing Indonesian regions, since the profession students were divided into hospitals unit throughout Indonesia. The result of the study revealed that, as in general, students stated that nurse educators could be excellent professional role models marked with mean score 3.61 out of 4. As in qualitative phase, emerged 4 themes, such as teaching by example as theme number 1. The second theme is altruism, followed by efficiently performing and effective communication. The discussion includes students reported that nurse educators could be excellent professional role models that support students to be independent and show compassion in the learning process, especially during in clinical practice. Some students also revealed that professional role models work according to standard operating procedures and ethics and carry out their duties well. A similar study identified several characteristics of professional role modeling behaviors, and most students, or more than 80%, believe that nurse educators have exhibited these behaviors. As the conclusion of the study identified that professionalism and positive attitude shown by nurse educators as role models during pandemic COVID-19. While involved in clinical practice, students generally agreed that nurse educators could be excellent professional role models, although some areas should be improved. The implications for nursing education and practice contributes to the knowledge of holistic nurses' characteristics by identifying the behavior of professional role models. Nursing students should be guided in their roles as future nurses and the clinical application of expected behavior as professional role models. So this is the end of my presentation, and should you have any questions to ask, please do ask on the session on breakout room. And on behalf of my team, I would like to say thank you for your attention and hope you all have a great day and great conference. Thank you.